This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Farrah Mateen. I'm a neurologist at Massachusetts General Hospital in Boston and co-editor of the Without Borders section of Neurology. Today, I am pleased to interview Sumaira of the Sumaira Foundation on her foundation's global initiatives on neuromyelitis optica spectrum disorder and myelin oligodendrocyte glycoprotein antibody-associated disease, including their Global Ambassador Program for people with NMO and MOGAD, and her newly developed Coalition for Health Equity. Thank you for joining us today, Sumaira.
Thank you for having me, Farrah.
So tell us about the Sumaira Foundation.
My name is Sumaira. First and foremost, I'd introduce myself as a seronegative NMOSD patient. So rewind back to 2014 in the summertime. I was a 25-year-old, otherwise healthy young woman who, long story short, suddenly lost vision and mobility in parts of my body. And turns out I was living with NMOSD. I was diagnosed within 5 weeks at Mass General Hospital, actually, coincidentally. And I was very fortunate to have gotten diagnosed so quickly. I was put on therapy right away. But when I left the hospital as a newly diagnosed rare disease patient, I left obviously feeling very unsettled because there wasn't really much in the form of support or awareness for NMOSD at the time. And everything on the internet made it pretty clear that the prognosis for this disease was not good. It was basically a death sentence. So I went home after my hospital stay where I got diagnosed and searched the internet feverishly for support, for resources. How do I learn more? Is there a celebrity with this? Is there an ice bucket challenge equivalent for NMOSD? And I couldn't really find what I was looking for. So basically, within 2 months of my diagnosis, I decided to kind of take matters into my own hands. And I launched the Sumaira Foundation. I had no idea what I was doing. And sometimes I would say I still don't. But we are now 9 years old, almost 10, and we are a global nonprofit organization dedicated to raising awareness of NMOSD, MOGAD, and now other rare neuroimmune conditions. We're incredibly passionate about building communities of support for patients and their caregivers. We fund research and we advocate on behalf of patients. And I think it's really important to share, and it's something I'm very passionate about, that we're incredibly proud to be patient-led, patient-powered, science-driven, therapy-agnostic, and we see diversity as a superpower. So in a nutshell, that is the Sumaira Foundation, also known as TSF.
I know you're a global organization now, so this is Without Borders. Can you tell us what you've learned about NMO globally?
I think it's important to share that I'm a child of immigrants. My parents immigrated to the U.S. Almost 40 years ago from Bangladesh, which at one point was considered one of the poorest countries in the world. I think that's a different story now in 2023. But a few years into my diagnosis, I started wondering, what would have happened if my parents didn't immigrate to the U.S. and I got diagnosed with this living in Bangladesh. And it started to really weigh on me. I was feeling all kinds of survivor's guilt, and it really kept me up at night. And then that sort of led me to discover more and more about the global community and the fact that actually 95% of our patients are outside of the U.S. And those patients in most countries do not have something like an entity like TSF to turn to, whether it's for education or support or community building. So NMOSD, like most rare diseases, often goes completely overlooked in many, many, many countries. Patients and caregivers really need support, community, and advocacy to manage their condition successfully. And I found that whenever TSF goes to a new country, we're oftentimes the very first organization to focus on NMOSD and MOGAD. And the impact that our work makes on patients and their loved ones is honestly really, really eye-opening. So just a very quick example, through a modest research grant working with Dr. Jose Flores, who's in Latin America, TSF earlier this year was able to help diagnose 125 new NMOSD and MOGAD patients in Mexico in just 2 months. And as we all know, the diagnosis is such an integral milestone in a patient's journey. So now these patients have a diagnosis and can move forward in their lives and with therapy. So in a nutshell, what have I learned about NMO globally? It's everywhere. Some places obviously have higher prevalence than others, but there are patients in all parts of the world. And the sad reality is that they don't have access to therapies. They don't have access to even diagnosis sometimes, correct diagnosis. And most certainly they don't have access to organizations like TSF.
I wanted to ask you specifically about the accuracy of NMOSD or NMO diagnosis, particularly aquaporin 4 and the antibody assay, and your observations on if people are actually getting tested and if they're getting tested with the highest quality possible assays, usually cell-based assays, in your experience.
Antibody test quality for NMOSD varies very widely around the world. I think people are still using all different kinds of tests, and not for any other reason other than that may be all that's available to them. And many clinicians, including neurologists, oftentimes don't even know the difference between these various tests and how to access them. Plus, the situation is further complicated by the increasing focus on MOGAD, which, really requires a cell-based assay to diagnose properly. So in summation, what I have seen in my almost 10 years of working in this field is that there are significant unmet needs in neuroimmunology testing around the world. And actually, this is something that the organization aims to address over the coming years.
Recently, the World Health Organization added new medicines for multiple sclerosis as an indication onto their model list for essential medicines. As of now, there's no specific NMO or MOGAD treatment, which is usual given that it's a rare disease. Do you have any thoughts about access to immunosuppression, particularly in lower income settings? I know that many countries I've worked in, people will be suspected to have NMO, but they wouldn't even have access to a treatment afterwards. And I'm wondering if you had any advocacy on that front.
Definitely. While we're very lucky to have 3 highly efficacious therapies approved for treating AQP4 positive NMOSD, they still remain unavailable and inaccessible to most people around the world. And in many cases, even Rituxan is either unavailable or unaffordable to patients. So as an organization, we believe and want all NMOSD patients to receive proper and timely diagnosis and treatment no matter where in the world that they live. And we're going to continue our efforts to expand availability and access of existing and future therapies for NMOSD and MOGAD patients. I can give you a very recent example of how our advocacy has helped or is helping patients get access to therapies. So some of these therapies are soon going to be available in Canada. And we, as an organization, wrote many letters of support, conducted surveys for all the different provinces in Canada to get these therapies approved. And I actually just got something in my inbox 20 minutes ago saying that one of them finally got approved in one of the main provinces in Canada. So there's still a lot of work to be done. I think the great news is, at least for aquaporin 4 positive NMOSD, we have disease-modifying therapies that are approved. And of course, rituximab is effective in many patients. But the reality is that they're still not accessible and affordable. So as a community, we need to start really thinking about how to make them accessible to patients. And I don't have all the answers, but I can promise that as a patient myself, as an advocate, and as the leader of an organization that has global reach, we will do whatever we can and whatever we're asked to do to get these made available.
I wanted to ask you about the global ambassadors for NMO program. Specifically, if you can share how many countries you're working with and how many languages patients and physicians and other healthcare workers can receive information in.
Sure. And this is one of my favorite topics to talk about. So just a bit of history. We launched the ambassador program in 2019, so just a year before COVID, kind of as a result of patients who had been following my journey, both as a patient and starting this foundation through social media. And I would oftentimes get asked by these patients and caregivers like, Sumaira, we love what you're doing. How do we get involved? And at the time, we didn't have an infrastructure for volunteers or for others to really get involved. It was so small. So I built this little pilot program, and we started with 9 patients in the US. And from 2019 to 2023, so what is that, for 4 years, we've now grown our team, which now has 62 patient caregivers and now MDs from 23 countries. So we have grown a lot. And in fact, most of our ambassadors are outside of the US. I would say probably 70% of our ambassadors are now outside of the US. And I think that's a telltale sign of how much advocacy, support, and community is actually needed outside of the US. In terms of how many countries do we work in and languages, so our website content is available in now 23 languages, Japanese being the most recently added language. It's not perfect, but Google Translate has really come in handy, and it offers something where in many places there is nothing. We have support group meetings in Denmark, France, Germany, India, Italy, the Netherlands, South Africa, the United States, the United Kingdom. And actually next week, we're launching our newest support group meeting in Spanish for any Spanish-speaking patients and caregivers around the world.
So that deserves a wow. So congratulations. So for practicing neurologists who want to learn more and stay up to date with the Sumaira Foundation's work and in general about NMOSD, where do they go to get more resources?
I think our website is a great place to start. We have a lot of information, so definitely check out our website. It's www.sumairafoundation.org. But alternatively, how to stay up to date on NMOSD and MOGAD, I think the best way is to follow the leading researchers. And many of these folks are actually on our medical advisory board. We also find that the leading neurology congresses are an excellent way to stay abreast of the tremendous research ongoing in this area. And I think it goes without saying, we're seeing an increasing number of NMOSD and MOGAD-related publications in some of the top medical journals. So there's definitely no shortage of content now, it seems, and there's incredible visibility of both diseases everywhere, it seems, whether it's poster presentations or oral presentations at conferences or, the journals, podcasts, webinars. It's crazy to see how much content there is now for patients and caregivers, and then, of course, for clinicians as well. This was certainly not the case when I first got diagnosed.
I wanted to ask you more about the double seronegative NMO story being, particularly challenging area, both scientifically and I imagine for patients as well. And I wanted to ask you about your future work on double seronegative NMOSD.
I'm a double seronegative patient. So I think having the lived experience of being sort of in this limbo really drives my passion for trying to decipher what's going on with double seronegative NMOSD patients. And I also am in touch with many, many, many patients around the world. So I know it's not just me, and I know that there's actually a sizable amount of us across the globe, and we're all sort of in this gray area wondering, what do we have? Is it real? What's going to happen to us, especially as the 2024 NMOSD guidelines update happens soon. So what I did was I started a Facebook group earlier this summer just to kind of mobilize the community. And in such a short amount of time, I was able to convene about 200 patients from around the world. I'm sure there's many, many, many more. So started there. And then, I designed and launched some merchandise because why not? But then we started doing webinars about double seronegative NMOSD in English. We did it with Owen Flanagan from Mayo. We recently did one in Italian with Elias Secchi from Sassari. And we will soon be doing one in French and hopefully other languages follow. We also did a podcast episode for our podcast, Demystifying NMO and MOG, featuring Sara Mariotto, who is at the University of Verona, and it also featured a fellow patient and myself. And something I'm really excited to share is that in 2024, we are sponsoring a lovely doctor from Sao Paulo. His name is João Oliveira, and he will be a fellow at MGH with Michael Levy and Marcelo Mattiello, and his primary focus will be on double seronegative NMOSD. So those are just some of the few things that we've put in place for double seronegative NMOSD. I'm sure we can do more, but we'll continue to learn as we go.
So speaking of lessons learned, recognize that even though each rare neurological disease is uncommon, collectively there are many people with rare neurological diseases on a global scale. And I'm curious what lessons you have for neurologists and patients for other rare neurological diseases.
Rare disease is not rare, right? We know this. There's about 600 million patients living with rare disease around the world. And patients living with rare diseases like NMOSD and MOGAD can be found virtually anywhere on the planet. As an organization, we see so many unmet needs around the world, and we really aim to replicate our approach country by country to help patients and caregivers affected by these tough conditions. Of course, every country will have its own unique set of challenges at times. But I think, Farrah, at the end of the day, regardless of what disease you have, the path is quite simple. I mean, I kind of see it as a recipe. You need a diagnosis, a correct diagnosis. You need a doctor who understands the disease and how to treat it. You need treatment, and then you need support and advocacy, perhaps. So it's a pretty simple formula that I think can be applied to virtually any disease.
The last question I really wanted to ask you is about your social media presence and how you've really empowered the NMO community through social media and been a really public example for so many people all around the world. And I just wanted to know what your personal thoughts are on a global movement for NMO now and how that's really become possible through social media and online communities.
Social media, it's one of those things where it's like everything, there's so many benefits. And then, of course, there are some downsides of it too. But I'm a millennial, and when I was becoming an adult, social media was becoming more of a thing. So I guess a digital native. And when all of this happened to me, the first place I went to was the internet, which is where social media is housed. And when I decided to do all of this, I realized that, hold on a second, social media can be used as a vehicle for more than just what it was being used for at the time. We can use it to find patients, to disseminate information, to engage with patients, to engage with the community, to even engage with doctors. I mean, you go on Twitter or X or whatever it's called now. So I think social media is a very, very powerful tool for advocacy and, of course, raising awareness. I think I adopted it very early on. In fact, I did. I know this for a fact because I studied PR at Boston University. So I was one of the early adopters of Twitter and LinkedIn. And so I think I had that advantage of really knowing how to use these channels. But it's been really wonderful for us. It's been one of our most powerful channels in reaching folks and getting our information out there. And the best part about it is that it's free. It's also very visual. I'm a very creative person by nature. So it allows us to tell a visual story in many times about what we're doing, what we're trying to do, our messaging, etc.
The last question I wanted to ask, knowing all the complexities and challenges of going global, why go global? There's a lot of work to be done, even in Boston, but you've made it a global movement. I think that's fabulous. But I just want to hear why go global, knowing how hard it is.
Yeah, well, it's definitely hard. That is true. But it was so necessary, and it is so necessary. And just because something's hard doesn't mean I'm not going to do it. In fact, it challenged me even more. And I think it was very clear. The more I got to connect with other patients online across the globe, the more obvious it became to me that, like, hey, I need to do something. I'm very fortunate to have had, I don't want to use the word success, but to have had the kind of impact that we wanted to achieve here in the US and then in Canada. but it didn't feel right that we were just doing this for an already privileged community. And I say that with love. Of course, we still have challenges here in the West and, North America specifically, but we are very privileged. We don't have nearly amount of issues as, some other countries do, especially in the lower middle income countries. So just going back to my previous statement about being a child of immigrants. So I have that sort of personal drive to do more for those who are less fortunate outside of the US, but also just listening and learning from the community and observing that there was such a need. I felt compelled to do something. And thankfully, we have a team who has a lot of experience working across multiple languages and countries. So we were able to do things rather quickly and efficiently. And we still have a very long way to go, but so far we're working in 5 continents. So actually, 6. The only one is Antarctica. But maybe one day we'll get there. I don't know if NMO is there, but we're trying our best, and as you said, it's not easy. It is hard. We run into all kinds of roadblocks and challenges, but it's not going to stop us from doing the right thing, which is to be available to the community, no matter where in the world that they are.
That's fabulous. And I'm sure if penguins got NMO, you would go to Antarctica, right?
I would love that. I hope they never do, but it would get me there. So that would be cool.
Yeah. Well, congratulations on all of your work. And thank you so much for spending time speaking with us today.
Oh, it's my pleasure. What an amazing opportunity.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.